Blog Talk Radio.
And welcome to another edition of Carnivore Radio. I'm your host, Jeff Sherman, along with Dr. Eric Lopkin. And we have a return guest, Dr. Lopkin, a guest last show we did with him was awesome, to say the least. Dr. Francis Cannizzo, he's a leading oncologist. He's also done a lot of work globally that we'll talk about in the pandemic area. So, Dr. Cannizzo, welcome to Carnivore Radio.
Thank you very much, guys. It's great to be back.
Yeah, so welcome to the show. And, we had such a great show last time you were on. And I just want to wrap up because myself and Dr. Lopkin agreed that the subject matter was quite good, and the feedback we got was also in line with my own and his perception, and that's about the coronavirus pandemic and how it's because of all the closures. I know things are expanding a bit, but the repercussions in terms of preventative care. If you as an oncologist, can you comment on that?
Yeah, I'd love to, Jeff. And first of all, I just want to thank you again for having me back on and inviting me to talk about something I really feel passionate about and I really think is an important issue that faces us all in this weird COVID pandemic time. The issue of delaying medical care has never been more in the public mind. There's a large number of people who are actively avoiding going to doctors and hospitals now, and that may seem odd in this time when there are so many people who are forced to go for medical care because of infectious diseases and other pandemic-related medical problems. But it's the preventative care and the routine medical care that really ends up taking a hit in times like these.
Yeah, and one thing I believe that I know that you said that was quite profound was this lagging type of situations may not show up for 3 or 4 years, like the individual that might not get the colonoscopy or the breast exam or whatever it is. As you know, as an oncologist, which, I have no familiarity with, that if time is of the essence. That's the critical factor, isn't it?
Yes, you're absolutely right. And you're absolutely right also about the time lag. It may be years before we see the results of some of these avoidance behaviors. Preventive care is defined as examinations of people who are asymptomatic, many of whom don't have a disease, only to find that small number of people who have an early enough form of a particular disease that we can treat it to cure. So we won't know who we miss until we actually miss people.
Yes, Dr. Lopkin, great point. Dr. Lopkin.
It really is a great point. I mean, I saw an article earlier today that said hospitals in the Northeast have seen a volume drop-off in patients of 48.5%. So you're talking about almost half of their usual traffic. And a big part of that is preventative. But it's not just, as the doctor just said, you're talking about some people that, may not have symptoms yet, but you're also talking about folks that have symptoms, have been diagnosed, but are afraid to go into the hospitals because of the coronavirus.
Actually, Dr. Cannizzo, the comment on that, because that's something that kind of escaped me. I thought it was more people more inclined, if they had cancer, obviously that would, I believe, trump the coronavirus kind of a thing. But is Dr. Lopkin correct that maybe even people with some conditions might postpone it because of a fear?
Yes, and that's the really dramatic part. You know, the CDC put out a fairly comprehensive paper in September looking at thousands of adult Americans and asking people if they've had their preventative care, if they're going to doctors, if they've actively avoided. Turns out that 40% of the adult American population who they included in this survey had avoided one or more medical treatments or diagnostic tests. And it wasn't just preventative stuff. And it's not always the populations you would expect. Sure, mixed into that 40% is a fair number of people with more than one medical comorbidity, the elderly, but, you know, young adults aged 18 to 24 years of age had a 50% greater chance of avoiding medical care and diagnostic treatments than did adults from 25 to 40. So it's young people, it's people with disabilities, it's people with obviously with known medical comorbidities and immune system problems. But, you know, there's a lot of people who are mixed in there who you would expect would be, you know, healthy enough to brave the pandemic.
Interesting. Dr. Lopkin, final question on this part of our interview with Dr. Cannizzo.
Yeah, you know, several weeks back, I had to take a little trip to the emergency room. And while I was there, did not run into any other patients. The plastic shields were everywhere. Everybody was masked. Can you talk a little bit about the precautions that medical centers, doctors' offices, and hospitals have taken during this pandemic?
Well, yeah, and that's a great question, because those are the things that have changed dramatically. You remember back in the spring when we were just starting to feel the brunt of the first surge of coronavirus, the knee-jerk reaction was to close everything down and keep everybody out. Fortunately, that kind of worked as a shock technique, but in reality, you couldn't shut those medical offices down and those hospitals down, and we had to find ways to keep people safe while they were, you know, congregating in doctors' offices and hospitals. So we transitioned to a lot of different kind of barrier methods, if you'll excuse the term, and we started using personal protective gear much more liberally, face masks and shields and breathing apparatuses and PAPRs and stuff like that, and then progressing to physical barriers when you can only put, if you're going to keep people 6 feet apart, then there is an absolute maximum number of people you could put in an emergency room. And unfortunately, emergency rooms don't really conform to maximums. There's times when there's going to be more people than you can treat. So the next generation of that was to put up all these plexiglass shields, install advanced air handlers with HEPA filters to try and keep the flow of air going and the return air clean. There were all sorts of cleaning products that came out from, you know, we started out with Lysol and Clorox, and we progressed to peroxide vaporizers that we now use. You know, as you know, they've become commonplace. The airlines use them to disinfect seats and tray tables between flights. So these kinds of things that were on the drawing board 8-12 months ago are now commonplace.
Okay, that's a great transition. The theme is commonplace, and what we really wanted to center on, and I think it was a great discussion we just had following up on the conversation we had several months ago, and that's about the new normal. And I'm not a doctor at all, but, I do teach and, I talk to students. There's in conversations like, what's going to change? And the subject is obviously in the era of pandemics. Things like, I talk about like buffets, I don't think they'll ever be around, that may be, but it's not going to be what it was. So is pandemics, and we're really kind of referencing your experience, your obviously your educational and experiential background as a doctor, but also maybe you could comment on some of the travels, especially lately you've done, that relates directly to the threats that we're facing because we live in a global community of pandemics. I mean, you look at the last pandemic, it was right after, or the last major impact of a pandemic was right after World War I, and we were in really a global community. To fast forward 100 years later, I mean, you look at what happened with Corona, supposedly, it happened in a wet market, and one person or two people might have gotten infected, and now half the world's infected. So I'll leave it up to your expertise. Could this be the new normal? Maybe not even medically, but psychologically.
Yeah, I agree it is. And I say that with a degree of reticence because I don't want to be somebody who's, coming on your show and kind of preaching doom and gloom. It is going to be the new normal, just like the globalization of anything is the new normal. Global travel, intercontinental, international travel is so prevalent. It's such a daily part of all of our lives, both in moving people and moving goods, that it's inevitable that we will share not only in the bounty of each of our economies, but also in the unfortunate side effects of infectious diseses, and that is part of the globally interconnected
don't
world.
we really play into I use the term lowest I don't mean it that way, but if there's some horrific disease in some country, I don't know, even 70 years ago, 60 years ago, that might have been contained. So we're at the mercy of the lowest common denominator in terms of a healthcare system, aren't we, to some degree?
Yes.
And medical and social practices.
You are absolutely correct. We are as sick, as a global community, we are as sick as our sickest members. And that, irrespective of what people's individual political beliefs might be, it is definitely to all of our benefits if the entire world's population becomes healthier. I'm not trying to espouse any particular policy or means of getting there. I'm just stating the fact that we're always going to catch the disease that the least developed sector of the global community has.
Dr. Lopkin, would you like to pivot on that? Because I think it's a quintessential point.
Actually, I would, but I'm going to hold off on that because we're up against a break. So we will be right back after this message.
To reach the next level, you need to operate at peak performance. The key to this is mastering the 7 elements of success. Learn how to master mindset, focus, operations, communications, innovation, evaluation metrics, and continuous improvement. Get the Biznetics way at Amazon, Barnes & Noble, Books A Million, and bookstores near you.
And we're back, and if you want to be part of the conversation, you can call us at 563-999-3693. That's 563-999-3693. Now, Doctor, you were just saying about how, we're only as healthy as the least healthy people on the globe. If I'm recalling right, you just recently spent some time in Africa. There's well-known, lack of medical facilities there. There's been a number of reported diseases there. What can we learn from handling crises in Africa that we can apply here?
Well, a couple of things. Interestingly, Africa, I was in northwestern Africa, and there was an extraordinarily low prevalence of coronavirus. And the reason for that is that northwestern Africa and much of the continent outside of, you know, the big cities of Nairobi and Ouagadougou and Johannesburg, in the more rural areas of Africa, the road system is not very well developed. People travel by, you know, from regional airport to regional airport that may only handle a dozen or so flights a day, and the shuffling of people around the various nations of the continent of Africa is much lower than in Asia or Europe or certainly the Americas. So the transmission of infectious diseases is lower, and we saw that several years ago in the Ebola outbreak in Northwest Africa. It was a terrible pandemic, but it really only affected a handful of the smallest countries in the northwest corner of Africa, and it did not have a chance to spread widely because the spread was largely overland and across land borders rather than spreading from airport to airport to airport like.
So the difference you're saying is a continent like Africa that doesn't have the infrastructure, that might have been the saving grace with Ebola versus coronavirus, which we assume started in China, which you have the infrastructure and you have the global travel. Is that not correct?
That is correct. But unfortunately, it doesn't give us a lot of answers because we can't roll back the clock on the globally interconnected world. We just have to learn to recognize things earlier and control the source.
Okay, and if you're doing the math, before I throw it out to Dr. Lopkin, it seems to me we're looking at a completely connected global community. I think COVID showed that. I know, you know, it came from a developed, at least economic country, which would be China. But as we talked about in reference before, I mean, if you just do the math, isn't it almost a done deal that within a certain amount of time there's going to be something else? I don't see how that doesn't happen. I'm not a doctor. I do not have your expertise. But it seems to me just rolling the dice, you know, if it happened in a wet market in China, I mean, it could happen in another market in the Sudan or somewhere else.
That is true. And the only thing that we have is our ability to recognize centers of infection and communicate widely. I think we could all agree, irrespective of what your particular position is on the management of the global pandemic. I think we could all agree that the communication in the very earliest parts of the infectious crisis were suboptimal.
Yeah, no, I would. No matter where you are, if you're a thinking person, regardless of your political idea, it really, if you looked at the international press, they were taken back, if you will, that, you know, United States was so deficient in that communication process. But yes, I would agree.
Well, I mean,
yes,
deficient, but what I'm talking about is at the source, there was very little communication for weeks and weeks to the global community that this was an infection that was beginning to rage out of control and posed a threat to multiple nations in their area.
I would agree with that. You're talking obviously from China, but could have that been more of a, you're talking about still, you know, very authoritarian state that they didn't want to admit they were wrong. I don't know the motivation, but there was something behind that it probably or possibly could have been relatively contained, but by the time these decisions are made, the cat was already out of the bag.
Right. I can't argue with that. That's sort of the way that I see it.
Dr. Lopkin.
Yep. Yeah, I'd like to sort of switch a little bit from how this started to where we go from here. I read a report a few days ago estimating that between the vaccinations that have already occurred and the people that have gotten COVID, that we are at about 77% herd immunity. Now, there's been a lot of confusion around that term. Could you define what herd immunity is and, how we can increase that?
Sure. Herd immunity really is a state of protection and immunity when a magic proportion of a population is immune to a disease. Now, I don't want to be intentionally cagey, but there's a lot of controversy over what that number is. Some people say it's 75%, some people say it's 90%. Whatever that number is, the concept is that enough people are immune to a disease so that your chances of passing that disease from person to person to person is limited after a string of one or two people are sick. So outbreaks rage.
Is a huge. I'm sorry, but is the
Sure.
quintessential point to Dr. Lopkin's question is that you combine people that are vaccinated with people that have been exposed. So are we at a certain point where maybe, I don't know what the percentage is, that are not vulnerable to this or not transmittable at this point?
We absolutely are, except we don't really know what that number is because the several hundred million people who've tested positive for coronavirus, we're not sure what proportion of those people are actually immune. So sometimes you get it and it doesn't generate an effective immunity.
Dr. Lopkin.
So, obviously, the larger the percentage of people who are immune, the better off we are. How is that affected? We've seen a couple of mutated viruses that have changed. How does that affect herd immunity? And is that a growing danger now that we have these mutated viruses?
It is a growing danger. It's always a growing danger whenever genetic variants appear in an infectious disease. Right now, we're in a relatively good position because the virus that we call B.1.1.1, which is the Wuhan virus, the index virus, has the exact same spike protein as the UK variant, which is B.1.1.7, and the South African version, which is B.1.351. Those three viruses, even though they have some genetic variation in some of their other genes, they have the same protein on their surface that all of the vaccines are targeted against. So you're still immune to all three of those variants. Now, we know that the UK variant is easier to transmit, and the South African variant may have a more serious course in people who are infected. But we know that that the vaccines that we have are good against all three. It's whatever variant is out there brewing that we don't know about.
Interesting. Now, somewhat on that subject, coronavirus, I certainly wouldn't want to get it, but its fatality rate wasn't huge. Ebola,
Correct.
Which I believe you had some experience with in terms of, in your travels and working in that area. I mean, and you're saying about how it wasn't transmitted globally like the Wuhan situation because of where it originated. What if the viruses were reversed? I mean, wasn't Ebola a lot more deadly? And what kind of a scourge could that have been?
Yeah, see, the thing about Ebola is it would have been an absolute nightmare although it would not have been as widespread as coronavirus. And I'll tell you why. It's definitely not a good thing. And that's because in Ebola, a person who is infected with Ebola has an extremely limited amount of time that they can transmit the virus to others before they become so sick that they can no longer act as a vector.
Okay.
It's not a good thing.
So,
it's a terrible disease.
As I understand it, and I'm oversimplifying this, I know, but the more deadly a disease, the harder it is to spread because the host dies from it, unfortunately, much faster and doesn't have the time to spread it to others.
Yeah.
Yeah.
Is that correct?
Yep. That's unfortunately true, yes.
So this might have been the perfect virus that's deadly enough to cause disruption in, the medical community, the economic community, the social fabric, depression, everything else, that it was the perfect situation in terms of it's not, Ebola that, as that deadly, but deadly enough, but yet you had many people. So it was a perfect spreadable disaster, correct?
I hadn't thought of it that way. That's an extraordinary observation, and it's entirely true. There's a band of perfect storm there.
Excellent. Dr. Lopkin.
Yeah, we've only got a few minutes left. If you could tell our listeners just recommendations in general. Obviously, everybody has been focusing on their health. What are the basics that people need to do to stay healthy that maybe they're not paying attention to?
One of the first things that goes by the wayside in these kinds of situations, and by these kinds of situations, pandemics, natural disasters, crisis level weather, international incidents. One of the first things that goes by the wayside is self-care. People don't take care of themselves. As simple as go out and take a walk, go out and get some exercise, eat something that didn't come frozen in a package, take care of yourself. That's the single best way to maintain good health and to maintain your maximum natural resistance to disease. And then wear a mask, wash your hands, go get vaccinated, and do all the things that everybody else is doing.
Dr. Cannizzo, we can't thank you enough. Our listeners can't thank you enough. Carnivore Radio can't thank you enough. Another great show. Correct, Dr. Lopkin?
Absolutely. It's always great when the doctor is here with us. There's some fantastic information that he's given us.
Thanks so much.
Thank you very much. I so appreciate the invitation to come on and talk to you.
Great. Another great show, and we'll have to have you on. Hopefully there won't be another pandemic. But, yeah, we'll have to have you on in the next couple of months. Thank you so much.
Maybe something else. Maybe we'll talk about sports.
Yeah, something more
There
uplifting.
you go.
There
Yeah.
you go.
All right. You've been listening to Carnivore Radio. We're here live at 4 o'clock every Friday at blogtalkradio.com/Carnivore Radio. You can catch the replay as well as the Carnivore Bites podcast and the rest of the Xvadio podcast network at xvadio.com/podcast, as well as the Apple Podcast app, Google Play, iHeartRadio, Spotify, Stitcher, and wherever you find podcasts. We'll see you next week.